Alright, so I did my first med check at the Pyxis. I made sure that I have all my required things to administer care to my patient. I have made sure that nothing's expired, open, or otherwise tampered with. Now I'm going to enter the room and start with my standards of care. Alright. Hello, my name's Nick. I'll be your nurse today. How you doing?
Good. Hi, Nick. How are you?
Can I get your name?
Ivy Armstrong,
Can I get your date of birth?
March 1964.
Alright. Do you have any allergies?
I'm allergic to latex.
Alright. Well, right now we have a catheter kit which has no latex in it. So we are here to provide a indwelling urinary catheter as well as administer 20 milligrams per milliliter of furosemide, which is a diuretic, to help you pass some of that fluid that you got. Alright, I'm going to bring you up to my level. Alright. Is it okay if I pull your sheets down?
Yes.
Alright. I'm gonna pull this curtain for some privacy. Is it okay if I pull your gown up?
Yes.
Okay. I'm sorry that you're gonna be a little exposed. Alright. Let me bring this right over here real quick. I'm gonna have you spread your legs just a bit so I can get started. Yeah. Alright. So I'm gonna have you get in a rock position with your legs. Alright. Before I get started. I'm taking this bag and I'll be using it to hold some of my trash while we do this.
Alright.
Hold on to this.
Do you have any allergies? Like the latex. Alright. Alright, so I hear that we are needing a catheter insertion and
Do my hand hygiene
furosemide for
real quick.
an IV med to help with fluid.
Get
Does that
this
sound
started.
right? Okay, how are you feeling? Okay, alright, well, clearly I got nothing with latex and I'm here to make fluid, so hopefully we get that taken care of, okay?
Alright, so I'm going
So
to
for
move this over here real quick.
I'm gonna do that first. I'm gonna
So I
hold it
have
at the end of the
here
bed, you did it.
just a few wipes to help get your perineal area clean.
Look at our intake and outtake for fluid and get this all sorted out, okay? So I'm going to go on the other side of the bed.
Is it okay if I touch you?
Yes.
All right.
Start the procedure, all right? Okay.
So I take this and I'm gonna open, and then I'm gonna go down. Take one, go down. Take this last one. Go straight down.
Okay. So I'm just
All
pulling
right.
your sheet back.
Now let me. Alright, so now I'm going to open.
Alright, Ivy, I'm gonna move your legs into the position I need them in. And it's just
Alright,
gonna kind of be
so
what
I
we
open
call
this away from me.
kind of like butterfly, but your feet work together.
Keeping in mind the 1 inch barrier of sterility. Alright,
Feeling okay, Ivy?
now I'm going to take sterile gloves. I have these because these actually fit my hands. I don't know what size those are.
Okay, I'm gonna prep my sterile area, okay?
Alright, so I'm opening this away from me. It's okay if I use this area right here?
Yes.
Alright. Okay, so there we go. Manufacturer error on that one. Alright. So I'm going to take my left hand. Up.
I'm not used to it.
Alright, so now I have everything here is sterile. So I'm going to take this sheet here and go shiny side down. Since it's all sterile, I can touch that. We do not need this. Alright. So I would take this, however, this would stay in my hand, so I'm going to act like I have been putting the iodine onto here, so. Alright, so here, when I touch here, I can no longer touch anything else sterile with this hand. So I take the first one, wipe down. Second one, wipe down. And then I take this one, right down. Alright. I would also have taken the lube, however, this was also not built for the mannequin, so I'm temporarily breaking the sterile field so I can grab the mannequin lube.
Riley, I'm going to be your nurse today. Can you tell me your name and date of birth? Ivy Armstrong, 39.
This is to help lube area for the insertion of the catheter, so I'm going to unsheath the
So
catheter.
I am here for
I'm going to take the tip Take about 1 to 2 inches of it and rub it in the lube.
For some of that excess
Alright.
fluid we've got going on. Are you feeling okay?
So, now I'm going to hold.
Alright, so we're gonna place that
This
on
open.
the catheter first, and I'm gonna be working at the end of the bed. Alright, Ivy, I'm just gonna put your legs into the position they need to be in.
Alright. Now I'm going to just quickly, now that I'm in the bladder, go an extra 1 to 2 inches in.
Now I'm gonna open my kit.
Alright, so now I'm going to. These, I no longer am sterile, so I can just go ahead and move along. The sterile part is in the body.
Making sure to
Don't need that.
hands in the 1/8 order.
Here's the sterile water that I'll be using to inflate the balloon inside of the in the catheter.
Alright, we're doing Terry Care. I have one towelette. I'm gonna pull your gap, okay?
Alright, I'm going to
Alright, you're gonna feel my
get
touch.
pulled back. Alright,
Claps doing one side.
now let's inflate the balloon. Pull off.
Another clap doing the other side.
Tug to make sure that it's in place.
Down the middle, making sure to
Alright,
rub it back.
and now I'm going to take this, keep it up above the leg to avoid pressure ulcers, and I'm going to hang it on a sturdy part of this bed. I'm going to take this leg strap.
Putting my sterile gloves on.
Now I'm going to take blue to blue.
Alright.
Now I'm going to take my gloves off,
Gloves on, so it's okay for me to touch
clean up after myself,
things.
cover you back up.
Goes like that. Press this.
Now let me put your leg back in.
Handy dandy.
Alright. I'll cover you back up real quick. And then I'll come over to this side where I'm going to administer your medication of 20 milligrams per milliliter furosemide. Put this over here real quick. Let me first do some hand hygiene. Put my things in here real quick. Alright. So we have in here in the order catheter and order for furosemide, So I have here
Alright, I need
20. I have 20 milligrams per milliliter furosemide for Ivy Armstrong, which I will be inserting through her IV port right here. I'm gonna do it now, and it is to help with the to provide a diuretic medication.
CC urine output.
I have all right. One, 11, 12, 13, 14, 15. 30.
Wrap it. If I had
I'm gonna hold it in my hand as
wrap it
I.
around and place the glue with the glue right here in order to take any samples for you.
First flush here, just to check patency.
Alright, Ivy, we are good to go ahead and
Alright, I see blood. Alright, now I'm gonna flush the rest of this.
feeling okay? Does it hurt?
I will have to clean this again after I prepare my medication. Alright, so I'm going to draw up 1 milliliter, but first I'm going to draw up 1 milliliter of air. Take the cap off. Take the medication. Inject the air. Invert. Draw up 1 milliliter.
Good.
Now I'm going to engage my safety and take off the needle. Put the red cap on. I'm going to throw away my sharps. So I have my medication here, drawn up for Ivy Armstrong. So let me do my final med check before I administer this medication. So I have Ivy Armstrong. And I have medication.
Alright, so I am going to grab this
And then I have the right dose. Route is intravenous through the IV. Times now. completed my med checks. I've checked the birth date of my patient. Alright. So now before I administer it, I'm going to wipe the port for 30 seconds. 1, 2, 3,
First, we are
10,
going
11,
to do the same
13, 14, 15, 16, 17.
three. Once again, this is our third main check. This is Ivy Armstrong with Laceline, 1 milliliter
Alright, 30.
for
Keeping this in my hand. I will administer this at a milliliter over a minute.
Pull back. You have good blood flow. It means the IV is working well. And then keep pushing to flush the line.
Disengage. Take my second flush, which I will also administer at the same rate that I did the medication. Which I'll then clamp to create positive pressure.
I'm going to inject our second saline flush at the same rate of the medicine, which is 1 milliliter per minute.
Take this off. Alright. Alright, Miss Ivy, is there anything else I can get you today?
No, thank you.
Alright, I'll be back shortly to take care of anything else you need. Make sure your call light's in your hand. Alright. Let me lower you down.